hi, my name's Jeanette. I'm going to be your nurse today. So first I'm going to be performing a cognitive assessment on you. It's going to take about 5 to 10 minutes. Is that okay?
Yes.
Okay. So first let me ask, what is your level of education?
AA degree.
Okay, so you have some college. Okay. So let's begin. So what is the year?
The year that I graduated?
No, what is the year today?
Oh, today, 2020.
Okay. And the season?
Fall.
Okay. The date?
November 6th.
Okay. And the day?
Saturday.
Okay. And the month?
November.
Okay. And where are we now?
In the living room.
Okay. And state?
California.
Okay. County?
Alameda.
City?
Castro Valley.
Okay. Are we in a hospital?
No.
Okay. So I'm going to name 3 objects and you're going to need to repeat them back to me. So banana, sunrise, chair.
Banana, sunrise, chair.
Okay, good job. And remember those objects for later because I'm going to ask you to repeat them. Can you spell world backwards to me?
DLROW.
Okay. And earlier I told you the name of 3 things. Can you tell me what those were?
Banana, sunrise, chair.
Okay. And can you name what this object is?
A pen.
Okay. And can you name what this is?
A watch.
Okay. Okay, repeat the phrase no ifs, ands, or buts.
No ifs, ands, or buts.
Yes. Okay. Okay, I'm going to give you a piece of paper in your right hand. You're going to fold it in half and put it on the floor. Okay. So I'm going to hand you a piece of paper. You're going to read it and do what it says. Okay. You're going to write a sentence about anything, but it must contain a noun and a verb. Okay, and hang on to that. I'm going to have you copy this drawing. I can hold it for you. Okay. The mini mental state examination is used for the detection of dementia in those aged 65 years or older. It's based on an education level of about 8 years, so if you have less than this, it can interfere with results. And it's about 85% sensitive, which means 85% of those with dementia that take this test will be considered positive. By asking the patient date and location, I'm trying to assess their orientation to place and time. My patient was able to answer everything correctly except for the date. But next time I would tell her that she got the date wrong and to try again. That way I can assess whether it's actually cognitive impairment or if it was just a mistake. Especially if the patient is retired, it could be easy to lose track of the specific date. So I gave my patient 9 out of 10 points for the first 2 questions. The patient was asked to repeat 3 objects immediately after I said it and then a few questions later. And by doing this, I'm testing her short and long-term memory. She was able to name all 3 objects both times, and so she was given 6 points for this. I had my patient spell the word world backwards, but an alternative to this would be to count backwards from 100 by 7s. This is testing the mind's ability to stay on track and also to do arithmetic. My patient was able to spell world backwards correctly, so she was given 5 points. My patient was shown 2 objects and asked to name them, and this is testing her language. She was correctly able to do this, and I gave her 2 points. I was testing her repetition when asked to repeat the phrase no ifs, ands, or buts. She was given 1 point for doing this correctly. When asked to take a piece of paper in her right hand, fold it in half, and put it on the floor, I was testing her praxis, which is associated with her ability to follow 3-step commands. People that struggle to do this may have trouble bathing, eating, dressing themselves, but she was given 3 points for being able to complete this task. I'm testing the patient's ability to follow directions when given a piece of paper and told to follow its command. She was able to do that, so I gave her 1 point. When asked to make up a sentence that must contain a noun and a verb, we were also looking to make sure that the sentence made sense. She wrote, "The dog is running," which contains both a noun and a verb and makes sense, so she received 1 point. When she was asked to copy the picture, we were looking for 2 5-sided figures with 1 angle overlapping. This is her drawing, and as you can see, she was able to copy it correctly, which earned her 1 point. Your score can range from 0 to 30 points. Her final score was 29 points, although if I did follow up on the date question, it could have been a 30. A score of 25 to 30 is considered no impairment. 20 to 25 is mild cognitive impairment. 10 to 20 is moderate cognitive impairment, and a score of 10 or less is severe cognitive impairment. But any score of 25 or less is positive for a possible dementia diagnosis and does require a follow-up.